doctors, how are you guys? It's been a while since I've been in front of this camera, so I thought that I would follow up with you guys. So I am going to be doing a 4-month post-op. Now that I'm 4 months, I made 4 months on the 18th of this month. And so now that I'm 4 months post-op, I am going to be doing a video for you guys just to show you my progress and the improvements that are needed. So that's going to be in the next video. I was going to run it all together, but I thought I'll just make it 2 separate videos. In this video, I'm just going to be addressing comments and also doing a Q&A, answering some questions all in a video in regards to my tummy tuck as far as cost and things like that. I know it's been a while, guys. That's because I've been on vacation for 1 month. We went to Hawaii for 2 weeks, and then we went to South Carolina for another 2 weeks. So we've been gone a total of 1 whole month. So now I'm getting back in the swings of things. I've changed brokerages lately, just recently, and then I also started a class, a psychology class for the summer. As for you guys who don't know, I am a real estate agent, and I'm currently going to school for a physical therapist. So anyway, guys, let's jump into this video. So one of the comments I want to address is someone made a comment about, I got a lot of comments. I made a video and I asked you guys, what did you think as far as my butt, what I should do as far as, you know, moving forward with that. Should I do more improvements or what should I do? I was asking you guys for your opinion. And so, guys, I always welcome everyone's opinion, whether it's negative or positive. Your critiques are very appreciated, but of course, there's always a way to give positive feedback, or I should say negative feedback, in a very positive way where it's not very hurtful. And you guys have been very supportive, so I really don't have any negative comments to address, and I really wouldn't even if I did. But one of the comments that were recently posted is that I shouldn't do more back because I'm going to appear fat. And I want to address that because the matter of the truth of the matter is I am fat. I consider myself to be fat or overweighted. I am actually 5'6" and 193 pounds, and I would like to be in the 170s. My goal is to be in the 180s by the end of this month, and I've been really working really hard to achieve that goal. Guys, in order to achieve any goal, you have to be first honest with yourself before you can be honest with anybody else. You really have to be honest with yourself. And again, the matter of the fact is I am overweight, and now that I've realized that and I embraced it, now I'm really working really hard to get my weight down. So when you guys see me in my 4-month post-op video and you're saying, wait, Naya, you know, there's some work that needs to be done, I'm very aware of that. It's because I do need to lose some weight. And I'm afraid that if I don't lose weight the right way, then I'm going to have saggy skin, although I underwent this surgery where he removed layers of loose skin as well as lipo, some areas which he didn't, I believe, in my opinion, that he didn't do it aggressively enough. So I am going to be addressing that in my 4-month post-op video. So first of all, let's jump into it. Who did my tummy tuck? Dr. Bancorft performed my tummy tuck. He's a very great surgeon. He has a very great personality, but I think that the mistake that I made was that I only interviewed one surgeon and I didn't go any further after that. I believed I chose him based on personality rather than results, and that was one of the mistakes I made. Do I believe he didn't do a good job? I'm not going to say that. I'm happy with the job that he's done, that I look better in clothes, and that I'm confident to wear clothes that I've never worn before, but I don't feel sexy. I don't feel sexy in my clothes. I didn't post a lot of pictures from Hawaii in my 2 pieces and my bathing suits because I didn't feel sexy nor attractive. And so I think that the overall objective, objective was to basically feel sexy and attractive in my clothes, in and out of clothes, actually. So Dr. Bancorft did my surgery. Where is he located? Dr. Bancorft is located in Surgland, Texas, and that is where he was located. And he also performed my procedure there in his office, in his operational room. Okay, the cost of my tummy tuck. Okay, the cost of the tummy tuck was $7,000. 7,000. It was $7,995, I believe. So I just like to say $8,000. I like to round things up. It was $8,000, and then he charged me additional $2,500 to do the fat grafting, to inject the fat that he removed from my body into my butt. So overall, totaled, I paid $10,500 for my whole procedure. So that addresses the question about cost. Someone asked about cost. Second of all, well, not second of all, but let's see, third question. How did someone ask the question, how did I feel on the flight for 8 hours going to Hawaii after having only been 3 months and having surgery? It was very tough, very, very tough. To this day, I am still sore, and I don't know if it's normal because I work out now that I'm 4 months, and so I'm sure that that plays a factor in the fact that I'm still sore. I was talking to one of my subscribers. She just had her surgery recently, and her and I have been communicating about her surgery she just had on the 19th, and she was saying that it hurts when she coughs or sneezes, and either or, it hurts to this day. I'm 4 months and it still hurts when I cough and I sneeze. It's very sore, but I try to do it cautiously, and I'm consciously aware of it because I don't want to tear anything or rip anything. I'm sure my stitches should have been dissolved by now, but I just want to be safe than sorry. So that's how I've been feeling as far as the healing process. The recovery was, it was difficult at some times because it was hard to breathe, and that's just part of the process. That is normal for most people. It was normal for me, and for most people I heard it was normal for them, and the doctor says it's normal. So I would say overall that is a normal experience throughout your tummy tuck as far as breathing, because when you have that abdominal repair, it really does, it restricts you from the inhaling and exhaling process. I mean, there's some restriction there, and so that made it very difficult for me to breathe. Would I do it again? Heck yes, I would do it again. Even though I feel like I need improvements, I still feel like this, I still feel confident, and not confident, but I'm still happy in wearing some clothes that I wouldn't wear before. Tonight, I just left from the movies with my spouse, and we went and saw Girls Trip. And this is what I wore. I'm going to show you guys what I wore to the movies. So this is what I wore to the movies, and this is something I would not normally wear. And of course, I've eaten and drinking, so there's a little swelling here. And I also have a garment on, well, actually, what do you call it? A spandex, I believe you call it. And then I have these tights on. And so this is what I wore to the movies. And normally this is something I wouldn't wear out in public, especially with the little rips along here. Now guys, this is not a fashion video, so please do not talk about well, that's not cute. Well, I didn't actually really ask you your opinion regarding that. So anyway guys, I'm sitting in my office recording this video. So yeah, so I do need improvements, and again, we're gonna discuss that in the next video. So basically, what were some of the other questions that I had? I don't recall, and I probably should be looking at them to help me to address some of the questions. But let's just talk, if you guys don't mind. Let's just talk for a moment. So, yeah, I think what's best is that I'm going to address the improvements that I need, that I am going to discuss with my doctor. We all know that I am unhappy with my butt. So I am going to show you guys my butt and what I'm talking about. I'm going to turn all the way around so that you may see. and I'm going to change my attire so that you may see the improvements also that I am referring to. Please keep in mind that I have eaten today, and so there is going to be some bloating there, as well as I've been drinking throughout the day. And so yeah, let's just jump right into this. Give me a moment to undress.